Did you know that gonorrhea can be dangerous, fatal, and deadly if left untreated? Many people have been asking if it is curable or not. Which particular drug is used to treat gonorrhea? In this video, I will state it clearly, correctly, and accurately. So, gonorrhea is a sexually transmitted infection (STI) caused by bacterium Neisseria gonorrhea. It mainly affects the mucous membrane. It commonly affects the urethra, the cervix, the pharynx or the throat, and the eyes. Though that of eyes is very rare but can be serious if left untreated. So, gonorrhea is curable and can be dangerous if left untreated. It is not a viral infection and it is not a fungal infection. Rather, it is a bacterial infection, meaning that it can be treated with antibiotics such as ceftriaxone. This antibiotic is very effective when it comes to treatment of gonorrhea. So, gonorrhea mainly affects the mucous membrane, especially those lining the reproductive tract, and it can also affect other sides of the body. So, gonorrhea is an infection and also a communicable disease, meaning that it can be passed from one person to another. Transmission mainly occur through direct sexual contact with an infected person. Because it is an infection, it can trigger immune response in the body, leading to inflammation and symptoms. Gonorrhea is classified as sexually transmitted infection because it is spread through vaginal sex, that is from penis to vagina or from vagina to penis, and also anal sex from penis to anus, and again oral sex from mouth to genital or from genital to mouth. It can also be passed from mother to the baby during childbirth but cannot be spread through casual contact like hugging, handshake, and sharing utensils and clothes. Like I said previously, gonorrhea is caused by bacterium Neisseria gonorrhea. Since it is a bacterial infection, it is curable and treatment require antibiotics. This clearly distinguishes it from viral sexually transmitted infections such as HIV and herpes, which cannot be cured. Gonorrhea mainly infects the warmest area of the body lined by mucous membrane such as urethra for urine passage, cervix in female, rectum, pharynx or throat, and eyes, especially in newborn. These tissues are the environment for the bacteria Neisseria gonorrhea to multiply and survive. That is the thing. It can cause local and systemic disease. In many people, gonorrhea can cause local infection with symptoms like discharge and pain, while in most cases, like in untreated, the bacteria can enter into the bloodstream and cause systemic infection, affecting the joints and the skin. So, gonorrhea is not just a minor infection, it can be serious and life-threatening, and it is often asymptomatic, meaning that people that have it shows no symptom. Some people that have gonorrhea can show no symptoms. That's what I mean by asymptomatic. It is usually asymptomatic. A very important part of gonorrhea is that many infected individuals have no symptoms. This is very common in female throat and rectal gonorrhea infection. Despite the absence of symptoms, the infected individual can transmit gonorrhea to another person silently. That's the fact. Therefore, gonorrhea is a common curable bacterial sexually transmitted infection caused by Neisseria gonorrhea, which primarily infects the mucous membrane or genital tract, rectum, throat, and eyes, which can be symptomatic, meaning presence of symptoms, and asymptomatic, absence of symptoms. Gonorrhea is not a viral infection. It is a bacterial infection, meaning that it can be treated with antibiotics. It is curable but dangerous if left untreated. So it is usually asymptomatic, and absence of symptoms does not mean absence of disease. What am I trying to say? Gonorrhea progresses in stages until complication. This is where prevention is better than cure, and prevention can be done by abstinence from vaginal sex, oral sex, and anal sex. And also, in pregnant individuals, there should be antenatal screening and care. From what I just explained now, you're supposed to have understood that before you have sex, you should get your partner tested. You should know the health status of your partner before you engage in sexual activity. And you should also use condom for prevention, though it doesn't guarantee 100% prevention of sexually transmitted infection, but it is also helpful. And also, giving a woman head, when your woman asks you to give her head, don't do such a thing. In fact, don't try such a thing. For me, it's an abomination and it's not good and it is not healthy. So do not put your mouth in vagina. Don't put your mouth in where doctors use and glove. It is not healthy and it is not encouraging. That is the lesson I pass in this video. Thank you for watching. If this video is very helpful, like, comment, and subscribe and share to the people that need it also. Thank you so much. Thank you for listening once again. See you next time.